You're listening to Happier, Healthier, a podcast presented by Conway Medical Center. In each episode, we bring you expert conversations and actionable strategies to help you navigate your health and well-being, fostering a happier, healthier life for yourself and your loved ones. This podcast is made possible by the CMC Foundation. Their impact in our community is truly transformative. Think about this. Since 2005, the CMC Foundation has funded over $700,000 in mammograms for underserved individuals. They've invested over $200,000 in scholarships for CMC employees continuing education over the last decade, directly strengthening our healthcare workforce. And through the CMC Smart Snacks program, they've supplied over $559,000 in provisions to Horry County children. The foundation also provides crucial support like over $8,000 for cancer patient transportation. These are just a few examples of how they actively enhance the health and quality of life for individuals in our community. Today, we're diving into a topic that's measured every single time you visit your primary care provider, yet is often misunderstood, and that is blood pressure. Why does that cuff go on your arm every visit, and what do those numbers really mean for your health? And what happens when those numbers climb too high? Family nurse practitioner Jessica Strickland joins us to break down everything from systolic and diastolic pressures to the silent dangers of hypertension and how lifestyle changes can make a profound difference. Jessica, welcome to the show.
We'll just start basic. So when we come to our primary care provider, they put the cuff on our arm, the nurse usually. What is that doing? Why does that happen every single time we go to our primary care provider?
The idea is whenever you come in to see the primary care, we want to look at your vitals. We want to see, where your blood pressure is. Is it high? Is it normal? And that way, during the visit, we can go ahead and adjust medications. Blood pressure is one of those things that if we see it high on one occasion, we're not going to make the diagnosis of blood pressure right there. We're going to have you go home. We'll probably give you a log, tell you, hey, call us if your blood pressure is consistently above 140 or 130 on the top, and over like 80 or 90 on the bottom. And if it is, and it's on, the high side more than one occasion, we'll have you come back in and we'll talk about what hypertension is and how we can best go about treating it.
I'm going to ask you a question that's going to sound pretty silly, but that cuff, how is it getting those numbers? What's it measuring?
So it's measuring your systolic pressure and your diastolic pressure. And so the systolic is the high one, the one that you see on the top, and the diastolic pressure is the number that you see on the bottom. And so we have goals for both of those numbers that we want them to be under. And a young, healthy person, ideally, we'd like to see it in the 120s, 130s. The older you get, we let that top number ride a little bit higher because we know with age, our vessels get a little more stiff. So we let you ride around, we like to keep you below 140 at that point. The bottom numbers we like to see, again, in an older person, we let you run a little bit higher. We might let it go to 90, but we like it to stay below that, and a younger person, less than 80.
And so what do those numbers mean in terms of a patient's health?
So the terms is, I guess the best way to answer that is, what is the blood pressure? It's a reading of the pressure within your body, kind of like if you thought of a water hose. The water hose is rated for so much pressure to go through it. Same thing with our vessels, and it's our heart's pumping ability to pump blood around our vascular system. And so what it's doing is it's measuring that pressure in our arm in real time.
So when people say they have high blood pressure and they're going to watch their sodium, why are they doing that?
Okay, so sodium is one of those things, makes our chips taste good and everything like that, but wherever sodium goes, water likes to follow. And so a lot of times that will cause the pressure in these vascular systems to go up because it's pulling more water into those vascular systems. So your blood pressure might be great, and then you go eat a bag of chips and you've got underlying high blood pressure, and then all of a sudden you check it and it's 150 because it's pulled all this fluid in, which that's when it becomes an issue.
And what are kind of the stages? So, because it doesn't go, normal to hypertension, what are kind of the stages between?
So the stages for blood pressure, normal in a young, healthy person, 120, you want it to be below there. Pre-hypertension is 120 to like 139 on the top, that top number. Stage 1 is 140 to 159, and then stage 2 is when you get 160 and above.
When is it a concern?
So again, in a young, healthy person, I'm talking about somebody with no comorbidities. They don't have anything going on. They're in their maybe their 30s, even early 40s. You want it to be less than the 130. It becomes a concern when we see it consistently running above that, because our bodies, just like anything else, they're rated for so much pressure to go through. And when it's consistently being hit with a high pressure, that can cause what's called end organ damage. And that's whenever the pressure is high and it's beating on, our eye vessels, and that can cause um, eye damage, or it can hit on the kidneys and cause kidney damage, and that's called nephropathy.
What, when somebody has hypertension, what does that mean?
So, hypertension means simply that the pressure that's in your vascular system is above what it should be. It's high, so hypertension. And so, with that, we can give a ton of different kinds of medications to bring that down. There's a bunch of different ones. They work in different ways. Some will make you bring that pressure down by urinating. Some will block different receptors in your heart. But we pick whatever one is best for you based on what your other symptoms are and what else you have going on as a whole.
What are some of the concerns about having high blood pressure for a long time? Like, what kind of issues can it lead to
What are,
later?
So, the biggest thing that I see in clinic is I have a person who's otherwise been healthy their entire life. They're getting a little bit older, and maybe they're not eating as good as they used to. Maybe they've gained some weight, and those things contribute to a high blood pressure. And in and of itself, people don't realize the issues there because a lot of times with high blood pressure, you have no symptoms. It's called a silent killer for a reason because a lot of people will walk around with it and they won't have any symptoms whatsoever. But the issue is when that pressure is consistently high and it's beating on those vessels, it can cause weakened areas in the vessels. And that can happen anywhere in the body. That can be in the brain. That would be called an aneurysm. That can happen in our abdominal aorta. That can cause an aneurysm there. Or it can cause just, a constant hitting on the kidneys, or, and that can cause nephropathy. There's a lot of different issues that it can cause down the line being untreated.
So if somebody's kind of starting to have early stages, maybe just consistently elevated blood pressure, can they do just lifestyle modifications or what do you think?
Absolutely. So that is always the first thing that we recommend, whenever you come in. Say you come into me and you see me in clinic. In the past, you've been doing fine, but maybe you've been running in 135, then up to 139, and today you're in my clinic and you're 145 and you've been checking it at home and it's consistently been high. We can sit down, we can talk about a few things. Losing, some weight will generally help quite a bit. I think, if I'm not mistaken, every 10 pounds that you are overweight, that's an extra mile of capillary bed that your heart has to pump through. So by losing weight, that certainly will help take some of the pressure off the heart, and will in turn bring your pressure down. Other things are going to be diet modifications, switching. Maybe instead of having, a bag of chips, you eat some fruit or something like that that has less sodium in it. All these things together can absolutely bring it down. The big thing is just making that lifestyle change long term so that you don't have rebound hypertension after if you change or go back to your old ways or old habits.
Awesome. Okay, I'll ask one more question. Earlier you mentioned that your blood pressure levels elevate as you age. I didn't really know
Sometimes.
that.
Sometimes, not always, but a lot of times as we age, our vessels can become a little more stenosed, a little more stiff. And so, and also as we get older, you can get to be a little bit more brittle, maybe a little bit more sensitive to medications than a younger person. So we try to be very careful in what we're prescribing for blood pressure, because what I don't want to happen is I don't want to take an elderly patient and aggressively put them on a medication that could in turn cause them to become so weak and fall, especially in a patient that, say that they're on a blood thinner for underlying atrial fibrillation. I'm now trying to manage their blood pressure in addition to that. I put them on something. I want to make sure that I'm going to slowly get them to goal and not drop them out the bottom and cause them to have like a passing out or a syncopal event. So we just have to be mindful of the age, how sensitive they are to pressure, what's their weight. There's a lot of things that go into it.
When you said
But
passing out and stuff, is that what hypotension is? Is that kind of what
yes,
happens?
exactly. So that's why with the blood pressure, we like you to keep a log so that whenever we are adjusting medications and things like that, we can see how responsive are you to the medication, and is it dropping you too low? Because you can also swing in the other direction. So we want to make sure that we're conservative with treatment, but we're still moving you in the right direction, and in hopes that you're not going to have any kind of episodes where you could become hypotensive and potentially pass out. We want to avoid that. I think the biggest thing with blood pressure that I personally have with my patients in the clinic is if I do any kind of adjustment on medications, I have them come back in within 1 week just so that we can recheck, see where you're at. Do I need to up your medicine or do I need to drop it down? Or is that medication causing a side effect? Do I need to switch you to something else entirely? So I think it's really, really important. I do really encourage anyone that's taking blood pressure medication to get their own cuff, have it at home. I do think that the upper arm cuffs are a lot more accurate, but if you are going to use a wrist cuff, make sure you're using it on your left wrist. You're sitting up straight, both feet on the ground, not talking, hand over your heart, and doing it consistently, same time, daily, so that you can get an accurate reading to bring back into your provider for review.
And do you need to uncross your legs?
Yes, both feet on the ground, uncrossed.
That happens to me every time. I'm always crossing my legs. I'm doing it right now. Well, thank
But
you for doing this.
absolutely, thank you for having me. It's always good to talk with you.
That's it for this episode of Happier Healthier. We appreciate you tuning in and hope you gained valuable insights for your health journey. Again, thank you to our sponsor, the CMC Foundation, for allowing us to bring you this information from experts for free. Discover more about the CMC Foundation's vital work in our community and how you can contribute to their mission by visiting cmcfoundationsc.com. That's cmcfoundationsc.com, or find the link in our show notes. And just as a reminder, all content discussed on CMC's Happier Healthier podcast are the individual opinions of our hosts and guests and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast to treat any medical condition for either yourself or others. Consult your own physician for any medical issues you may be having. This disclaimer applies to any guest or contributor to the podcast. Be sure to subscribe so you don't miss our next episode of Happier Healthier, proudly brought to you by Conway Medical Center.